A group of over 640 GPs have signed a petition seeking conscientious objection. And over the weekend, we saw up to half a meeting of doctors in an emergency general meeting walk out and leave the meeting in disarray. Now, hundreds of GPs on the ground do not believe that general practice is the appropriate setting in which to deliver abortion services, for a large number of reasons, not least because of the lack of capacity in an area that's already overstretched, the lack of training that's involved, and the lack of availability of ultrasound. And then, obviously, the very serious issue of delivering genuine freedom of conscience, protecting doctors who don't want to get involved in this. Now, it's mind-blowing how this has happened. Because the first the GPs heard about abortions being GP-led was when Minister Simon Harris announced it on radio. That's the first time that these GPs stated that they actually heard of it. And from that day to this group of GPs had never once had a chance to sit down and discuss their matter with Minister Harris. And he's imposing abortion on their particular sector. Now, with regards to the pharmacists, despite requests obviously from the pharmacists' representative bodies, the Irish Pharmacy Union and the Hospital Pharmacists Association of Ireland, there has been no engagement with the Minister for pharmacists who have conscientious objection. And also, it's important to realise that over 500 nurses and midwives in 3 weeks and these are midwives on the NMBI register, have signed a petition for Simon Harris to call on him to protect freedom of conscience and support the amendments in relation to freedom of conscience. Now, the Nurses and Midwives for Life Group Ireland have claimed that the Minister, Simon Harris, and the Fianna Fáil leader, Micheál Martin, have refused to meet them to discuss their concern with conscientious objection legislation. Now, if the Minister were to introduce a bill on hedge cutting, the Minister would take about a year's worth of consultation within that sector before he actually brought the legislation through. It's absolutely phenomenal. A bill would have the stakeholders of that particular sector will be consulted with for a year. And yet these doctors, these nurses, these pharmacists have all been denied access to discuss directly with the Minister the issues that they have. Now, these are the people whose shoulders the health service sits. These are the people who are filling the gaps of the disastrous funding in health service at the moment. And yet this is the Minister who has spoken about little else in the last 2 years, is pointing to them and asking them to take the weight on this particular issue. I think the Minister has been a very just as well, I've been talking to a few of those nurses and midwives, and they've been telling me now there's a values clarification workshop being rolled out in the hospitals, and they're asking the nurses and midwives to reassess their own particular values with regards to the introduction to this particular service. And there's a little bit there's an Orwellian feeling around this when we are going to people who studied and strove and worked to protect and save life, to re-evaluate their values, reassess and evaluate their values on such an important issue. Now, you know, I think the Minister has been a unifier in many ways. Obviously, we see 750,000 people on hospital waiting lists. We see 10,000 people on hospital trolleys last month. We see 2,500 people, children, waiting over a year for their first mental health appointment. And now, the people working in that sector are also being attacked by the Minister. Because the Minister was on the radio today, and the Minister says that these people had conscientious obstruction, not conscientious objection. It's incredible. The people who are actually working within the health service want to do a day's work, want to save and protect, are being attacked in such a manner. Now, I suppose this is obviously a terrible accusation to level at a doctor or a nurse as they seek to defend their conscientious objection. And obviously we have to remind ourselves the import of what they're being asked to do. The bill asks and says that termination of pregnancy is the ending of a life of a fetus. And it just shocks me that we haven't had that level of consultation at all. And if you build something without that level of consultation, I guarantee you there will be problems in it. That's the purpose of consultation. The purpose of consultation is to iron out the difficulties that could arise in future. Now, I know that the Minister is hungry to get this through. I think the Minister has probably staked a bit of his reputation on the timescale of this being pushed through. But surely this is more important than the reputation of a minister and whether it happens on the 1st of January or the 1st of February. Surely the outcomes, the potential pitfalls, are actually the important issue that we as TDs should actually be functioning on. Now, just the amendment itself that we seek to provide here reframes the bill so that there's a positive and substantive protection for the freedom of conscience. The current section 24(1) says that nothing in this bill obliges a doctor, nurse or midwife to participate in carrying out a termination under 11, 13 or 14. However, Minister, it leaves a significant gap in the protection of those people, because it merely says the bill itself does not force doctors or nurses or midwives to participate. It therefore does not prevent the imposition of such a compulsion by an employer, a professional body, or even an individual seeking to get promoted or get through a particular piece of work. So accordingly, the amendments that we have done fills that particular gap. And listen, Minister, don't ever say that we don't listen to you, because we do listen to you. And actually the way we framed this particular amendment is the direct words that you used at the Health Committee yourself. You said that what you want to see, this level of protection for doctors, nurses and midwives will be included in the bill. So we said, okay, rather than actually go for the yellow pack conscientious objection that exists in the bill, let's lift your words off the blacks from the committee, put them into amendment and slot it into the bill itself. And I'll tell you one thing, Minister, this is the most dangerous aspect of the implementation of your bill, because as a number of other deputies have stated here, there is a large number of healthcare professionals that will not implement this as you have laid out. They are going to refuse to implement it. And the problem is that the abortion services that you seek to provide will be as chaotic as the health services that you preside over.